everyone, Alex and I are here to debate on whether some medical images should be continued. The CAT scan, also called the CAT scan, is painless, and after the scan, the patient can resume their normal activity.
But the problem is that before the scan, patients had to starve for 4 to 6 hours, and they had to lie down still for a few minutes during the scan, and they had to hold their breath.
But the doctors can get a 3D view.
It may be useful, but radiation is a very big problem for the CAT scans. It's very dangerous and can harm people, and it may take a week for results to come out. Radiation is a big problem for CAT scans. What do you have to say about that?
Well, what does radiation do to your body?
It causes cancer and it mutates your body.
Well, good things about CAT scan is that they're painless and they give a 3D view.
But it takes a week for results to come out. So the patients can't know for a whole week what's wrong with their body.
Well, is there any reason why they need to know in a week?
Well, it's better because they could do something about it if they know. And also, a bad thing is that you have to lie down still for a few minutes and you have to hold your breath while taking the scan. So it may be uncomfortable for the patient, so they might not really like the CAT scan.
Well, if the patient is going to find out if they have a disease, then if I were the patient, I would wait that long. The MRI, a medical scanning device, shows detailed views of tissues, and the doctor can see different body structures, like soft tissues. The MRI can detect cancers, which is very useful.
But not everyone could get scanned. People with implants like pacemakers, which are mechanical devices that help the heartbeat, cannot be scanned.
But unlike the CAT scans, the MRIs do not use radiation, so it does not harm people. Also, there are no side effects.
But it takes 30 minutes to an hour to scan.
This problem is solved because new versions are more comfortable because they have more space. Also, the results come out immediately, and normal activities can be continued.
Do you think it's worth getting an MRI scan that takes 30 minutes to an hour long?
Well, unlike CAT scan, MRI scans do not use radiation, so it doesn't harm your body. And after 30 minutes to an hour, you could get results if you have a disease or not. So I would use the MRI scanning device.
But how about people with pacemakers?
Well,
they can't get scanned, so.
Well, not a lot of people have pacemakers, so it's good for the people that do not have it. The DSR, which stands for Dynamic Spatial Reconstruction, measures change of shape and time of a three-dimensional object. It also shows organs in 3D moving images. It scans the heart, the lungs, and circulation. The DSR can also detect early stages of heart disease and lung cancer.
The problem about the DSR is that there's only one in the whole world at the Mayo Clinic in Minnesota. That's a very big problem. All these other medical imagings are available, but the DSR is not. Also, it is very expensive.
And?
Well, the DSR requires special training to operate, so it can't be handled by anyone. Also, the device is very large and expensive, so if there's a problem, it's going to be really hard to repair because of the price. Don't you think they should just get rid of the DSR because there's only one in the world, so not a lot of people can access it?
Well, because they already made it, people that could access it could use it, but the other people could use different types of scanning devices, so I don't think it's reasonable that they should get rid of it. The PET scan, also called the PET scan, is useful because it shows how tissues and organs function. The doctor can see changes at the moment instead of after the disease develops. The PET scan can detect cancer, brain disorder, heart problems, and other nervous system issues. and there are little preparations.
Well, not really, because patients can't eat for 6 to 12 hours. And also, it takes 2 hours to complete the scan. And the scan is very expensive. So the PET scan is expensive, takes 2 hours to complete, and the patients can't eat for 6 to 12 hours before the scan. Do you think it's worth getting it?
Well, you said these stuff, it might be bad, but at the end, you could find out if you have a disease or not. So, if after a patient gets PET scans, pretend they find out that they get cancer, then they could cure it. But if they didn't take the PET scans, then they would have never known. Sonograms allows you to observe pregnancy. They are safe because they don't use radiation, but they use sound waves. They are more detailed than x-rays. Also, they are not uncomfortable and they are painless. The mother doesn't have to worry about taking the scan because the baby is safe. Birth problems can be found early too. Multiple pregnancy can be detected so that the doctors can be prepared. The baby's gender can be also known by using the sonogram.
But I don't really like how the patients can't eat or drink for 24 hours before getting their abdomen scanned.
Alex, why do you dislike how patients can't eat before scans?
So the 5 different medical imagings that we debated on in general are actually pretty useful. And even though they might have a few negative aspects, I think they should be continued.